Hi everybody, I'm so excited to share the research I've been doing this semester with all of you. A thorough literature search revealed that breastfeeding reduces the incidence of sudden infant death syndrome and reduces the severity and incidence of acute infections in Aboriginal infants. This is significant as Aboriginal infants, this includes First Nation, Métis, and Inuit, have disproportionately higher incidence of SIDS and acute infections in infancy. Breastfeeding is the most economically feasible health promotion intervention. Therefore, a health promotion priority should be to increase breastfeeding initiation rates within the Aboriginal population. My intervention can briefly be summarized as the use of in-person surveys to collect the raw data pertaining to breastfeeding confidence, beliefs, and supports within the Inuit community. The Inuit community was chosen as they have the lowest breastfeeding rates in Canada. Therefore, increasing breastfeeding initiation rates within this population would have the greatest impact. I will briefly review the Aboriginal medicine wheel with respect to my intervention. The medicine wheel can be described as a proactive, empowering approach to social intervention that aids the practitioner to provide holistic care. The four elements of the wheel are emotional, mental, spiritual, and physical. The emotional aspect will be addressed through the assessment of a woman's confidence in her ability to breastfeed. It will further be addressed through the assessment of the available supports at both the individual and community level. The mental aspect will be addressed through the assessment of the community's baseline knowledge and understanding of the benefits to breastfeeding. The spiritual element will be addressed through the assessment of the beliefs of the cultural and historical practices of breastfeeding. The spiritual element will further be addressed through the engagement of community elders. The physical element will be addressed through the assessment of the physical demands of breastfeeding and through the assessment of the perceived and actual barriers to breastfeeding within the community. Successful interventions within isolated, culturally rich communities can only be done through engagement and partnership with the community. This means providing culturally sensitive and respectful interventions. Furthermore, interventions will only be sustainable if they appropriately address the needs of the community as stated by the community. That is why the collection of the raw data is so imperative. Thank you.